I'm Nikki Holbrook. I'm a primary special ed teacher. My specialty is multiple handicapped. I was transferring one day this little boy from the floor back into his wheelchair, and he startled. And he stiffened up and pushed himself back, and I was holding his trunk, and I was pushed against a table, and my arm caught, and I fell to the floor, and I was still holding the student, and I actually tore a muscle off my shoulder blade.
My name is Jason Sharkey. I'm a groundskeeper for the city. Yeah, I was driving home one night and I had fell asleep at the wheel. Went across a bridge, the wrong side of the bridge. Jumped the river, hitting the cement embankment there. Broke my collarbone, 2 ribs, collapsed my lung because of the seatbelt, and had a head injury as a result of that, and broke my jaw also.
I'm Kathy Canis. I'm a cost accountant at CTV Television Network, and basically I spend the day on a computer terminal. I have carpal tunnel syndrome. The right hand has been operated on, and the main symptom was my hand would be numb. There was a great deal of pain in the wrist area.
I'm Catherine Hofstetter, and I'm the president of McGowan Fence and Supply Limited. We are installers of commercial chain link fencing, and we also retail and wholesale. I have rheumatoid arthritis, and I had an onset about 2.5 years ago. It was a very severe onset. The disease progressed very aggressively, and over a period of just a few months, it had spread through all the joints in my body, and I was virtually unable to walk.
Occupational therapy is all about well-being. As a health science, occupational therapy, or OT, encompasses just about every aspect of a person's capacity for a productive and fulfilling life. OT goes far beyond mere treatment. It educates and trains people to relearn their daily living skills and how to cope with the demands and stresses of daily living. For example, when someone injures their hand, they'll get treatment for that injury, and the hand will heal. But it's the occupational therapist who will show a person how to use the hand again, to put on socks, to weed the garden, to use a computer, to get back to work. Examples of how occupational therapy does that can range from guidance in how to use a limb again following injury, to current issues of health and well-being, providing counseling for things like emotional stress or burnout. And OT can offer consultation services in ergonomic design, for example, making the computer workstation a place that's user-friendly. The goal of the occupational therapist can also be to teach people how to perform their everyday life functions with less pain and fatigue.
The therapists helped me get back to the point where I had strength in my hand. Before I had the surgery, because of the extreme pain, my productivity levels were really low. It took a long time to complete my normal daily tasks, and as a result I was doing overtime in order to get just the basic job done. Now, after the surgery and with the splint from my left hand, whenever it bothers me, my productivity is back up to where it should be, and my job is much easier to get done, and it's more of a pleasure to go in.
I saw my therapist after 3 months in the hospital, and then she came out to my house to see me. And she first started on the writing, and she brought a program to my house and helped me with typing. And so that was a big help. That was a really big help.
You're in. Now, we're going to go read a book at the table, all right? My occupational therapist showed me how to position myself. She taught me how to transfer the students without any stress to myself whatsoever. She taught me time limits of how positioning in certain time limits, because if you stay in a position for a certain length of time, that would aggravate the injury.
One of the things that the occupational therapist taught me was to do exercises with my hands. My hands were considerable concern at the outset because of the damage that was occurring to them, and probably because my right hand is my dominant hand. That was the worst. And they gave me exercises, which they call range of motion exercises, so that I would be able to maintain grip strength and maintain the range that I could stretch my hands and be able to maintain my manual dexterity. I think that the most important thing that I gained personally from occupational therapy is regaining my independence. For me, occupational therapy doesn't end the last time you see the OT. It's a continuing self-education that they teach you how to learn and continue to learn to help yourself and retain your independence so that you won't be afraid anymore.
With OT in the workplace, whether on-site or through employee benefits, an employer can be assured of getting the most comprehensive range of treatments available from a single healthcare source. Treatment following injury or illness. Treatment for common repetitive strain injuries, such as carpal tunnel syndrome. For those recovering from stroke or heart attack. For injuries such as head trauma as the result of an accident. And OT provides help and support for people with depression or work-related stress. For employers, it makes good business sense to include OT in employees' benefits. There are cost savings. Employees with access to occupational therapy are likely to get back to work sooner and be better equipped for the demands of the job.
When you say occupational therapy, I think of preventative medicine, I think of accessibility, and I think of independence.
I've got from occupational therapy, I've got a diploma under my belt, and also I'm working right now, and that's very good because I'm making money.
The occupational therapists that I have worked with have all been very strong, self-assured people, very compassionate, very gentle people, and have treated me with so much respect. They've really made me feel like I'm a strong, independent person again.